Welcome to From Days to Years. I'm your host, Angie Lee, and we're at HCA in Brandon, and we're talking to Dr. Cooper today, who is an OBGYN, and we're so excited for you to be here. Thank you for joining us today.
Yeah, thank you so much for having me. I'm excited to be here.
And Dr. Cooper is going to answer some questions for us about being an OBGYN, and she's talking on behalf of herself, not of the hospital, not of HCA, and just her experience as being a doctor, okay? All right, with that being said, how did you decide to be an OBGYN? What was your inspiration?
Well, I actually always wanted to be an OBGYN.
Okay.
I think a lot of people, their story is they decide they want to go to medical school, they go through their rotations, and we see all of the different specialties, and it's kind of hard for them to choose. But in my case, I actually went to medical school to be an OBGYN. Okay. When I was in undergrad, at first I thought I wanted to do something completely different, like math or physics, or I'm sorry. I honestly don't even really know what I wanted to do, but in my biology class, I remember learning about mitosis and meiosis, and I was just so amazed that we could form a whole human being just out of cells, that it would just grow into a person with a soul that was living and breathing, and I thought that was amazing. So I reached out to a local OBGYN to see if I could shadow him, and he said okay, and I was kind of hooked from there. So it was really the obstetric standpoint, seeing new life, and wanting to be a part of that for a long time to come.
That is so awesome. Because one of the things I was talking to Laura about, and she said that you get to celebrate birthdays every day. I never thought of an OBGYN as, how did you come up with that? I get to celebrate birthdays every day.
I don't know. I feel like I just said it one time and it's become my catchphrase. I'm always like, we're here to have birthday parties and I get to be a part of them every day, and it's just exciting.
That is awesome. That is awesome. So if you want to be an OBGYN, this is the path to take. You get to celebrate birthdays, so think about that, girls, when you're at home.
Exactly. What better thing to do every day?
Better thing to do. So one of the things we wanted to talk about, this month is all about pink. I had a friend on an earlier episode, we talked about breast cancer, and she now has stage 4 breast cancer, which is sad. Yeah. So things that women need to get done are mammograms. Now, I will be honest with you, I have not had one. I am well over 40. And I need to get them. Mm-hmm. So how often should we be getting those? When should we start getting them?
So mammograms are a great screening tool. I will say breast cancer is a pretty common cancer in women, but the good news is that with early detection, the 5-year survival rate is 90%, which is really great for a cancer. Yeah. As far as mammograms, we typically start around age 40. So you should go. And we recommend screening every 1 to 2 years, depending on risk factors.
And then, so you go in. Now, again, I've never had one. So how does this work? Because they say you should do them in the shower. So if I'm in the shower and I just how do you do one? I know I look very awkward, but do you flat hand and just kind of push your boob in?
For a self-breast exam?
Yes. We'll talk about that one and then go back to the actual one.
Okay, so self-breast exams are really just you feeling for anything that feels out of the ordinary. Okay. So one important thing to remember is that we have breast tissue all the way into our armpit.
Yeah, I have a lot of that. It came after the baby.
Yeah.
All of a sudden, I'm a little flabby there.
Yep. So you can even get breast cancer and little lumps all the way into your armpit.
Really?
So typically we start around the nipple and we go kind of in a circle going out, feeling for anything unusual, and then you feel all the way into your armpit on both sides.
It's very personal.
Yeah, it is. And so that's something we do at our doctor's office or at an OBGYN when you come for your annual visit. But really, it's more important for you to be doing it on your own because you know what feels normal to you.
But in the shower, so you put your arm up, or you put it out, or you put it behind your back?
It doesn't really matter how you do it, to be honest. Okay. You really just want to feel for anything that's new or different. Okay. And, some women have lumps and bumps and kind of fibrocystic tissue, we call it. And if you have that, that's fine. Really, you're just feeling for something that's different to you. And it's important for you to do it because if me doing an exam once a year, I'm not obviously feeling your boobs every day. So you need to feel them.
So maybe I should have my husband do that. I'm just saying. Too much information? I'm just saying. Because he probably knows he's better than I do.
Yep, that is true.
Maybe that's another episode.
Husbands do breast exams.
Yes. They do. And they don't even have them. Well, maybe they do. Anyway.
Some do.
Because my friend, the way she found it the second time, she was sitting at a soccer game, and she was feeling her neck, and she found a lump up here. Yeah. And it was amazing that, not amazing good, amazing bad, that because she had been doing this for so long, she was able to find that, to find out that she needed to go back again.
Yeah, and see, it's good that she was feeling, though, and it's good. You have to advocate for yourself, too.
Yeah. And that's one of the things that she is having to do. All right, so when you make sure you're getting this how often should we do self-breast exams?
There's no good evidence for a specific time. You know, sometimes I feel like we used to say every month, but really it's just any time you're in the shower, just feeling what feels normal to you. So just when you're washing, you can take a feel. You don't need to take extra time out of your day really to be doing this. It's just kind of being conscious of it.
Yeah. And what if you're like, I don't know, I still have no idea. I'm going to have to just go in. I know I should go in.
You can do it. I believe in you.
Thank you. And I don't know what it is. I just think, you know what the problem is? I'm fine. I'm like, I'm fine. I'm healthy enough. Like, I have rheumatoid arthritis. Yes, I know. I know. But I'm like, I don't have cancer, so I don't need to go. But that's a very stupid form of thinking.
It is. And like I said, the 5-year survival for breast cancer is so high, but that's because we have early screening. So it is important that you go. Once you have symptoms, it's not that it's always too late, but it's going to be much, much harder to treat than if we can catch it before you even know that it's a problem.
Yeah. And are there different types of screening? So there's self-breast exam you do at home where you're trying to feel for lumps, bumps, or oddities. And then you go in and they do a mammogram?
Yeah.
How does that work?
So a mammogram is essentially an x-ray of your breast tissue. So they kind of just sandwich the breast tissue and take an image of it. That's kind of the mainstay of screening that starts when you're 40. But there are other imaging modalities depending on your risk factors. There's more specific mammograms and imaging they can do. And sometimes when you're younger, if you do notice a lump or a bump, we'll do an ultrasound just because we're younger and we don't need the mammogram yet.
Why do they wait? And you probably don't know the answer to this because you didn't come up with these. But I wonder, and I'll have to find out, why they tell us to wait till we're 40. Because
Well, one of the biggest risk factors for breast cancer is age. So before 40, if you don't have risk factors or a strong family history, then it's not necessary to have screening. If you have a strong family history of breast cancer, or if you have the BRCA gene, for example, which you might be familiar with.
No.
So BRCA1 and BRCA2, they're two genetic mutations that carry a very strong risk of breast cancer. Typically, women will get tested for this if they have family members that have had breast cancer. If you do have that gene or some others, they'll recommend screening earlier.
Because I have an aunt who had breast cancer, and then I think it has come back now that she's gotten a little bit older, and she's fought it for a long time. Yeah. And then cancer runs in my family, unfortunately. Like, my sister died of cancer. My dad has stage 4 cancer now. He's doing fine, thank God. And then my grandmother died of lung cancer, but it was from smoking. So the idea of me not going to get a mammogram is stupid. I think it's a little bit of a fear, too.
Understandable.
It's like, if I don't know about it, then I'm fine. But if it's there, then I know about it, and all these people have had this experience in my family, then it's like I have to deal with it. And I think that's part of the problem. I think that might be a fear for a lot of other women, too.
It's even a fear for me. I feel like everybody deals with that. I can give you the example. I've been avoiding going to the dentist, and I know that's awful. Don't judge me.
I don't judge you. I haven't been in 2 years.
But you're always scared of what they're going to do, so you're like, oh, it's fine. But really, we need to just go and, take ownership of our health, because it is important, and I don't think it's as scary as we think. It's just taking that first step and getting there.
That's the thing. It's taking ownership of your health. I like the way you said that.
Yeah.
Taking ownership of your health. I'm not going to let my health scare me.
Exactly.
I'm going to take ownership of it. I like this. Now, you talked about the different types of screenings, and so the worst thing that possibly could happen would be that you could have breast cancer, and then you have a series of things that can happen. Can you touch on that?
Yeah.
Or allude to what could possibly happen if you do get breast cancer. This is a possibility, this is an if, and this is Dr. Cooper's opinion of what could happen, okay? Because your case and experience will vary.
Yeah. So I can't give you the best specifics because every case is different, and typically, from my standpoint at least, if we were to send someone and they were diagnosed with breast cancer, then they go to a breast specialist or to like a hematologist, oncologist.
What's a hematologist?
Well, a hematologist is a blood doctor, but an oncologist would be like a cancer doctor.
That one I am very familiar with, unfortunately.
Yeah, so from the most mild, I guess, if they found a lump and it was benign and they could just remove that lump and then that would be it. Yeah. All the way to the extreme of needing chemotherapy, radiation, or a mastectomy where they remove the breast tissue. In some cases, they do lymph node biopsies where they look for the spread of cancer. It all really depends on the type and how far it's spread and many, many things.
And your lymph nodes, those are and your neck.
Mm-hmm. And
they
your
have
neck
to-
and your armpit.
and your armpits.
Yep, your lymph nodes are everywhere.
So this is breast tissue, not lymph node, right?
It's probably both.
Both.
Mm-hmm.
Yeah. This did not, sorry, this is way too much for me. This did not happen until after the child. I don't
Yeah.
know what happened, but all of a sudden things
all
just
spread
it
out.
spread out. And after I lost the weight after the baby, it went away. But then when I started gaining weight back, then all of a sudden it went out here.
Came back. Yeah.
I don't know. I probably should get checked out.
You should go.
I should
you
go.
should go.
I should go. And the lymph nodes. Okay, sorry, going back a little bit. Lymph nodes. That's what drains things from your body.
It's like what
is a lymph
drains.
node?
They're a part of your immune system.
Okay.
So like when you're sick and you feel your swollen lymph nodes in your neck sometimes,
Yeah.
that's kind of a similar idea. So when you have cancer, it spreads through your lymph nodes.
Okay. Because my sister, when she was diagnosed, it was too late by the time they found it. But it wasn't breast cancer. It was something else, a rare form of cancer. I don't even know the name of it.
Yeah.
But that's where she they found it.
They
It
found
was
it
her
in
lymph
her.
nodes. But it was too late.
Yeah.
And she did surgery, and she decided she didn't want to do
Didn't wanna-
chemo. But she got the surgery, and they thought maybe, but it was too late.
Mm.
But there was
I'm
no way for
sorry.
her to
That's
find
really
out.
hard. Yeah.
It was. But I mean, she was 27, and she had a good life.
Yeah.
But you never forget.
Well, yeah. Not long enough of a life.
No, not long enough. Not long enough at all. Anyway, yeah. So again, getting back to if you're over 40, which I am, and I'm going to schedule the mammogram this year, y'all. I'm going to do it. Hold me to it. Before December, I'm going to somebody's office and getting my boobs felt up by a stranger with cold metal and no dinner beforehand.
You're going to feel so good after. You're
Yes.
going to be so glad you did it.
I'm going to ask for the dinner, though.
Yeah.
At least a drink. Just say, if we're going to be that person, well, can I get something out of this besides?
I always say we need to put like posters or something on the ceiling for people to look at. Like some places they play music. I feel like we need to make it a little bit better. What would make it better if going to the
Dinner and a drink.
OBGYN?
I'm just
Well,
saying,
I
if
don't
you're
think
gonna
we're
fill me
allowed
up,
to do that.
we need something.
We have like the little to-go wines on the way out.
To-go wine. All right, HCA. Again, this is my opinion. Can we get to-go wines? Or an Uber also. That would also help.
Yeah.
So that would make me feel so much
Or
better.
maybe like a wine before,
Yes.
and then the Uber home.
Yes, the Uber home. Yes,
Okay.
yes. that would be great.
I'll keep that in mind.
They're not going to do it, people, so it's not going to happen. But we're just going to ask. So, how long does it take for the whole process? You schedule it, you go in, they put you between the plates.
Yeah, it's
and then,
quick.
Is it quick?
Yeah, I mean, it's just like going for any scheduled imaging you have. It's just an X-ray, so I bet the longest part is going to be waiting to get called to go back there.
Okay.
And then it's going to be quick, and you'll have your results. They get sent to your doctor's office, and then we usually call you or we discuss them at your next visit.
Okay, well, that's not too bad. And then after, so let's say I go in, which I'm going to go in before the end of the year. Now I've made this promise. How often should I go back if my results are, you're fine, Angie, you got nothing. You still got your rheumatoid arthritis, but you don't have cancer or anything. So how often do you go back?
So it would be every 1 to 2 years, depending on risk factors
Okay.
or family history.
Okay.
So that would be kind of dependent on you talking with your doctor. But, yep, every year or two.
I also don't have a doctor down here.
Well, that's step one. That's all right. I won't tell anyone.
Thank you. No one's going to know. No one's going to know, right? Y'all aren't going to tell anybody?
Oh, man.
So I got to get a doctor, then I got to get an OBGYN, then I'll go in for my mammogram.
Yeah,
I'm going to get this all done before Christmas.
you got it.
Okay.
I'll be following up.
I know
now
she
you have me.
will.
I'll be calling. Like, excuse me. Have you gone to the doctor yet?
This is terrible. And this is why we're doing the show, because there's so many women like me who are afraid to go in. We don't want to know. And even if the results are negative, you just, that extra knowledge of the weight of having to deal with that. And it's very stupid. It's a very stupid and careless way of living, and you're not taking ownership of your health, like Dr. Cooper said. So I need to do that, and I'm going to. Is there any, so there's no scary part of it, the only uncomfortable part of the plates. Anything else that we should kind of know when we're going in there? It's just really just an image.
It's really just an image. It's like an X-ray.
Okay. Okay.
That's it.
What about the pap smear thing? I haven't had that done either.
Oh my goodness, you're killing me.
I know I am.
So pap smear, I can go into more about the guidelines. I won't bore you with the specifics, but we do different types of pap smears depending on your age, looking for the cells specifically versus HPV, and really you only need screening every 3 years if it's negative.
Okay.
We still want you to come in for your annual, but we don't have to subject you to the pap smear if it was negative prior.
Okay, so I haven't been to OBGYN since our daughter was 2, maybe 1. She's 9 now.
You
I have
should
no
come.
doctor. I've not had a pap smear. I've never had a mammogram, and I don't have an OBGYN.
Well,
I'm
that's
on,
okay.
I'm on Santa's naughty list, aren't I?
But yes, you just need to
I'm
go.
on Santa's naughty
Just
list.
come.
Okay.
We're not scary.
Okay, Valerie's raising her hand too.
Let me know you're coming. Maybe I can bring you some wine. But
Would you?
don't tell anybody.
Okay, don't tell anybody. Dr. Cooper's not bringing me wine. It's juice.
It is.
It's Welch's. Okay.
No, you can do it.
So every 3 years, you get the pap smear. Every 1 to 2 years, you get a mammogram.
Mm-hmm.
Anything else I'm supposed to be doing for this reproductive health thing?
No.
Because I'm doing it wrong, obviously.
As long as you go for your annual every year, we will take care of all of your concerns. I promise.
In your head, you're like, this lady's really not doing very
You know,
well.
we always recommend that you have a primary doctor and an OBGYN, but we do have the capability of drawing all of your routine labs as well. You know, OBGYNs, we are almost like primary care for women because we're taking care of all organs, you know. So if you just want to come to us, that's fine. We will take care of everything for you.
Make it easy. Just schedule everything for me. Just call me, Angie, this is what you're, okay, I'll just come. Just make it no-brainer.
Mm-hmm.
Yeah, I mean, I have one, but just this kind of thing, I don't
You can even schedule online these days.
You can?
Mm-hmm.
Okay, so I should have known that, right? One other question. This is not on there.
Yes.
Can you find it in your blood, or is it really just like the lumps and bumps thing?
So it's really
know.
the lumps and bumps. The imaging is going to be the best. Really, the only blood work they do would be, like I said, for the BRCA1 or 2 or any type of genetic testing you're doing, but we don't do that routinely on everyone because, like I said, it really would be just if you have an extensive family history that we would be looking for something like that.
Okay. What are the heartwarming aspects of your job? Like, again, one of your sayings that I love is you get to have birthdays every day, but tell us some of the heartwarming aspects. Not when you have someone sitting next to you who's an OBGYN doctor in the middle of the heartwarming.
That, I have to say, is the most heartwarming part, is just being able to bring new life into the world. That's why I wanted to do this, and it really is the best part. You know, the hours are long. It's not always happy, but in that moment, it really is. And it's crazy to see. I always like to look at the dads' faces. They're so sweet, though. But it is heartwarming, and just actually being a part of the delivery and seeing that moment. I don't even know how to describe it. I've tried to describe this before, but before the baby is here, you know that they're coming, but it's almost like a figment of your imagination. And like you can see the top of their head crowning and mom is pushing, but then there's the second where the baby goes from being a part of mom to just being another human here, like a new soul in the earth. And I think that's amazing. And I mean, even talking about it gives me chills, honestly, because the wonder of that never wears off. It doesn't.
And that's the good part. Like, I have a sister as a doctor, a sister as a nurse, and my mom's a nurse. And they see a lot, things they can't tell me because there's all kinds of laws. And frankly, I don't want to know. I just really don't want to know. But they talk about the heartwarming aspect like you are. And they're like, you know, when you get to see that life or when you get to help someone, it makes you feel good. I mean, technically it's your job, but really it's not your job to care, but you do.
Yeah.
And to be a caring doctor, it really helps the patients. Like I remember back when, now 9 years ago, when I gave birth to our daughter, and I had a midwife. I didn't do any OBGYN because I was concerned that they would put me into surgery or do a C-section. I didn't want to do that. And we were nervous because it was our first one, and we were a one-and-done family because I was an old mommy. I was 37. At least that's what they told me.
Yeah, we like to use mean terms.
I was an old
You're
mommy.
not old, though.
It was vintage. It was vintage. And my midwife, there was a moment when they're like, okay, we're going to have to take you out. You can't. This is not working. You're going to have to go. Her heart rate's dropping. Your heart rate's dropping. You're going to have to go. And my husband are like, I don't want a C-section. She wants to have it. And they're like, well, you're probably going to have to go. And I had told them earlier, I said, if you're calm, I'll be calm. Yeah. And at one point, there were like 10 people rushing into the room because things were starting to take a turn for the worse. And it ended up being okay. We were able to have the baby naturally. They said, if you don't get this baby out in so long, that's it, you're done. We're going. And we were able to get out, she was out on like the 4th push or something.
Wow.
I mean, they were
Good
like, okay.
It's on.
It's on.
She's coming out.
It was game on. It was like, I've never played football, but they're like, push this baby out like you're a lady. It was me and the midwife and somebody else, and we got that sucker out. My child, not the sucker. but the heartwarming aspects. And I'll never forget my midwife, and I'll never forget the nurse that was in there. And you're not getting paid to care, but when you do, you can feel that. And I don't remember her name. I couldn't see her face if you told me there, but I remember how much she cared.
Yeah, exactly. Yeah,
And
it makes
that-
all the difference.
It does. So I wanted to say thank you for all those women that you help and all those birthdays you celebrate. Thank you.
Of course.
Because it
I
means
love
so
it.
much.
Yeah.
Thank you. Oh, I'm going to tear up again. Thank you. Thank you.
Yeah.
So is there anything else that you'd like to add about, I know I'm going to go, I promise by Christmas.
Yeah. Nothing. Yeah, I'm just going to call you and make sure you go to the doctor. And everyone watching, go get your mammograms. Go to your annual visits. We're not scary, I promise.
I like her. If she wasn't so far away, I'd come and see her. Thank you so much for coming in and tuning in on this episode with Dr. Cooper. Again, these are Dr. Cooper's opinions and her experiences, not of HCA, not of HCA of Brandon, it's just her opinion, and we appreciate her and sharing her knowledge with us. Make sure you like and share it and subscribe on all of our social media channels. Thank you. Bye.